Hi, my name is Rachel Jairus. I live in Lincoln. I'm here as a nurse with experience in healthcare quality improvement, and I'm here in support of Bill 678. Although I was a nurse with medical knowledge and about pregnancy and childbirth, I still wasn't able to be my own advocate during a very complicated delivery for my second child. I actually really don't remember very much except being hooked up to IVs, monitors, and having people hover around me. But I was very fortunate because I received adequate care. However, not every woman receives appropriate, timely care, and that's especially dire for Black women and women who live in poverty, who experience a maternal mortality rate and delivery complications and negative birth outcomes at significantly higher rates than privately insured white women. In 2018, a report came out from 9 state-based maternal mortality review committees, and they estimated that about 700 women die every year as the result of pregnancy or pregnancy-related complications, and 60% of those deaths were preventable. However, the 700 deaths each year related to pregnancy overshadow an even larger problem because, according to the same report, 100 times that number of women experience what healthcare professionals refer to as severe maternal mortality, which is a close call with death related to pregnancy. That's more than 190 women per day in the United States. I looked at the Rhode Island data, and that would be about 5 women per week in Rhode Island. It's a misconception that life-threatening complications related to pregnancy are rare. They are not, and there are huge opportunities to improve care. A study in the Journal of Perinatal Education demonstrated that expectant mothers matched with a doula had much better outcomes. Doula-assisted mothers were 4 times less likely to have a low birth rate baby, 2 times less likely to experience a birth complication, and continuous doula support was also associated with higher Apgar scores, which is the score that, in case anyone doesn't know, when babies are first born, that indicates whether or not infant mortality, if they're at risk for infant mortality. The mothers were also more likely to initiate breastfeeding, and I can say from my own personal experience, all of those things are very overwhelming to a woman, especially for their first child. The positive effects of doula care have been found to be greater for women who are socially disadvantaged, have low income, who had language or cultural barriers, or were first-time mothers. However, the cost of doula services is a significant barrier to those who would benefit from it most. So it's critically important that doula care is a covered service for all women. And it shouldn't really matter what you look like, what community you live in, or how much money you make, as to whether or not a woman gets the care that they need and deserve. There's also a strong economic argument for covering doula services. The U.S. is the only developed country where the maternal mortality rate is rising, and the U.S. has the worst maternal and child health outcomes while spending the most money for any high-income nation. Multiple studies have reinforced the case that doula care is a cost-effective method to improve outcomes for mothers and infants. With the support of doulas, many women are able to avoid a cesarean section, which is much more expensive than a vaginal birth. And an article in the American Journal of Public Health revealed that for Medicaid beneficiaries nationally, the cesarean rate was only 22.3% among doula-supported births, as compared to 31.5% for doula-supported Medicaid beneficiaries, under the assumption that a state could reduce the cesarean rate to 22.3, which would be a great thing for mothers, by the way, because the cesarean birth is more likely to have complications. If they offered birth, so being able to reduce it to 22.3% by offering doula services, states could potentially save millions of dollars. And that would just be in cesarean births. There are loads of complications that could be avoided. Doulas are trained to provide physical, emotional, and informational support to women during pregnancy, labor, birth, and the immediate postpartum period, which is essential. They're doing the work that's necessary to give mothers and babies a better chance at survival, and we have to be sure that all women have access to this care. And I'm asking you to please move this bill to the Senate floor for a vote, and please vote yes. Thank you.